Welcome back to 5 Talk Street. I'm Christy Nelson. We've always heard the phrase, give the gift of life, give blood. Carter Bloodcare, our local blood bank, needs our help. September is Sickle Cell Awareness Month, and joining me now to explain how blood donations help patients with sickle cell disease is Dr. William Cruz, Medical Director of Laboratory Services for Carter Bloodcare. Thanks for joining us today.
Thank you for having me. It's a privilege to be here with you today.
So we're talking about sickle cell disease. I have a cousin who died of that. I have other relatives with the trait. So I know a little bit about it, but I think that most people in general actually still don't know what it is and what it means. Can you explain a little bit about it?
Sure. So sickle cell disease is an inherited disorder. It's a genetic disorder where the person who has it, they inherited two abnormal genes, one from their mom, one from their dad. And that results in an abnormal hemoglobin. It's called hemoglobin S. That causes the cell to change shapes and cause a lot of complications.
So how is it that the sickle cells cause so much pain? Because pain is actually one of the major symptoms of this, right?
Right. I mean, sickle cell is a very debilitating disease, and many patients who have sickle cell disease have these painful crises where they have to usually go to the emergency room to seek alleviation and treatment for their pain. They can't control it with just over-the-counter medication, and they'll have to get very strong medications, opioids. And what really happens, an analogy I like to use is a donut and a croissant. I mean, the donut's the normal red cell, the croissant is the abnormal sickle cell. And what happens is when the blood has to flow through the capillaries, which is the very, very tiny blood vessel, cells have to line up in single file. And the sickle cells, they're sticky, they're rigid, they can't bend, and they stick to the lining of the capillary, block off the flow of blood, and therefore it blocks off the oxygen.
So one thing I did not know is that people who live with sickle cell disease actually need blood transfusions to help treat it.
Right.
And they're not like regular blood transfusions?
That's correct. So for a certain subset of sickle cell patients, like if a patient has a stroke, and to prevent them from having a subsequent stroke, they will need to undergo transfusions for the rest of their life. And it's a special transfusion called exchange transfusion, and it's where the patient is connected to an apheresis machine. And this machine has the ability to infuse fresh donor blood, and at the same time remove the old sickle blood. And
how often are these transfusions needed?
It usually will need to be done every 4 to 6 weeks.
Wow.
Yeah, so because blood cells live about 120 days on a normal person. For a sickle cell, their blood cells may only live for 10 or 20 days. And so due to that, you have to have these continuous transfusions periodically.
Of course, which is why we're talking about donating blood, because there are people out there who need these transfusions frequently.
Yes, the need is constant. Our reference lab, we may get 30 requests for patients to be transfused in a week. And what I'd like to also mention is this exchange transfusion, you have to calculate patient's blood volume, and that's based on their height and weight. And so for an adult, they could take 7 to 8 units each time they do an exchange transfusion. So if we get a request for 30 patients, let's say on average, they'll need 5 units. That's 150 units just in 1 week.
And I think I read that many more patients need these transfusions but aren't getting them. Why is that?
Well, it's just probably that their doctor is not aware that the exchange transfusion is possible, and you can't do an exchange transfusion in a doctor's office. So you have to coordinate with a hospital or some other facility that has the equipment, that has the staff to perform the exchange transfusions.
Okay, so we can help by donating blood, right?
Absolutely. I mean, there's always a need for blood transfusions, and so if anyone out there is interested, they can go to carterbloodcare.org. All right.
Well, thank you so much for joining us today and explaining all of this.
Thank you.
This complicated stuff. And thanks for joining us for this edition of 5 Talk Street. I'm Christy Nelson. We'll see you next time.